Ribs AP oblique above and below the diaphragm, LPO or RPO. The patient is in the upright or supine position. Use the upright position for ribs above the diaphragm and supine for the ribs below the diaphragm. Have the patient raise the arm nearest the image receptor and place under the head to raise the scapula away from the rib cage. Abduct the opposite limb, placing hand on the hip. Rotate the patient's body to the right or left 45 degrees, placing the affected side closest to the image receptor. Center the image receptor top 1.5 inches above the relaxed shoulder and the lower edge of the image receptor at the level of the iliac crest to image the ribs below the diaphragm. The central ray is between the lateral margin of the ribs and spine 3 to 4 inches below the jugular notch, or T7, for above the diaphragm, and midway between the xiphoid and lower rib cage for below the diaphragm. Collimation improves radiographic contrast. Shield gonads. Suspend respiration on inspiration for above the diaphragm and expiration for below the diaphragm. Ribs 1 through 9 should be included and seen above the diaphragm, and ribs 8 through 12 should be seen below the diaphragm. The axillary portion of the ribs should be free of superimposition.